So in a grade 2 or close to grade 2 spondylolisthesis, when practically there is barely any space left here, that makes sense, I guess, pedicle, vertebral body, and especially when it's collapsed, we have to try to be as close to this location here as possible. And then when sometimes it's really not possible, in those cases, then I put a small little bend over the tip of the K-wire, and I put a coker here on top that I can rotate it, and I try to use the bend here to get around the corner of the osteophyte. Either way, if you remember, there is a sleeve here. So practically what it is that the K-wire, I get as close as possible. Sometimes it's not possible, sometimes it's hard, but as close as possible. Then I put the sleeve down. Then I put the coker just about 2 millimeters, not more, on top of this. I put the coker here and I hammer on it. So obviously K-wire goes wider, farther, and I hammered on it to either turn it around, get it into the disc base. Sometimes it's enough disc base to get it in, but sometimes you just have to accept that you are going to lock it into the bone, just the tip, few millimeters, the tip of the K-wire with this technique. You need that sleeve down, you need 2 millimeters, otherwise it just bends and doesn't really do what it wants you to do. Once you have done that, and so you are pretty much at the border between two bones, this part has to go pretty fast. Imagine now we look at it from top. First, you put the dilator over the K-wire at the best possible position. And first you go 1 centimeter in, that opens up the space. But then at that point, you're like that with the dilator. Then you have to drop it to go more horizontal. You drop it to become more horizontal, so you go across. This is the AP view. This is the lateral view. So first, you get the tip however you can in. You go just 1 centimeter, not more. Once 1 centimeter of the dilator is in, you drop it to go across. And that really helps you to do this grade 2 spondylolisthesis. Thank you.